who is a professor and director of pharmacy professional development at the University of Mississippi, I believe in Oxford, Mississippi.
Well, no, actually, I'm in Jackson.
You're in Jackson.
I'm based out of Jackson. We have 2 campuses.
Oh, that's right. Jackson is the clinical site. Yeah.
Yep.
And it's my pleasure to interview him. I consider him an academic leader. And he's been president of ACCP, and he's our incoming president of AACP. And I've had the pleasure of getting to know Stuart over the years, not only as a professional colleague, but also as a friend and a member of the editorial board of AJPE. So I'm going to turn it over to Stuart, and I'll start off with the first question, which is we'd like to learn about your journey to your current position and recognition as an academic leader. In other words, maybe share with us some key events or even people in your life that influence you in this journey.
Yeah. Well, the number of people certainly is numerous, and too numerous to enumerate all of them. But as you mentioned, I'm currently professor of pharmacy practice and also the director of professional development at the University of Mississippi. And it's a role that I get to do all sorts of really cool stuff every day, or at least I think it's cool stuff, like teaching students and residents, but also developing professional development programs for pharmacists around the country. And this really brings together a lot of my interests using instructional technology, education, and practice-related topics. And I began my career as a practitioner, and so I think bringing all these themes together here later in my career has really been a delight for me. I've been involved in professional associations since I was a student, and so I was involved with the American Pharmacists Association. I mean, I have been for a number of years. I often speak at their meetings, the American Society of Health System Pharmacists. I speak a lot and do a lot with that association, particularly as it relates to professional development. But I think the 2 organizations that, as you've mentioned, that I've been most involved with is the American College of Clinical Pharmacy, and which, I served as the president back in 2008, and then more recently been very involved with the American Association of Colleges of Pharmacy, which I'll be entering as their president-elect this July. So those have been the 2 organizations that has been really instrumental in my leadership development, if you will. While I'm really looking forward to the presidential role, I have to say that being a president of an organization, an organization is not really about the president. It's more about the engagement of its members and, and its staff too. So it's really the membership and the staff that makes an organization a really great organization. A president is kind of a figurehead. Hopefully, we're good role models, that we're kind of people that are good cheerleaders, and we're giving good direction about the right kinds of projects that the association should be pursuing and that sort of thing, and that we're good examples in terms of our words and deeds. But it's been certainly a pleasure to have served in these presidential roles. In terms of my journey, though, to these leadership roles, most people's professional journeys are filled with twists and turns, many of which I could have never predicted and didn't plan. Fundamentally, the things that have been under my control is really preparing myself as a professional to be competent through both my education and training and experiences. And of course, there's been plenty of luck that has blessed my path, being in the right places at the right time and meeting the right people. So for example, I became a pharmacist at a time when the Bachelor's of Science in Pharmacy was the entry-level degree for the profession. And at that time, only a small fraction of people went on and did residencies. But I I got interested in doing a residency. I wanted a leadership position. I wanted to be a director of pharmacy. And so I did a residency, and only 2 people in my graduating class did residencies.
Wow.
So, and this was a graduating class of 280 students, by the
Wow.
way, at Massachusetts College of Pharmacy.
Wow.
And then after doing my residency, because I had this additional training, I actually was offered a position as a director of pharmacy for a small chain of pharmacies in southern New Hampshire. And so at the age of 23, I was a director of pharmacy, which really, is extraordinary in and of itself. And it doesn't really speak to my talent or anything like that. It was just, I met the right people at the right times in the right place, that someone wanted to have someone young and energetic to become their director. And so that was at Freedom Drug. And then after doing that for a number of years, I decided to return to school. One thing that happened at Freedom Drug is the director agreed to fund a residency training program at a community pharmacy. My residency was in a hospital-based residency training program. And so they agreed to fund this residency. I really enjoyed being the director of that residency program. And that's what led me to decide to go back to school to get a doctoral degree so that I could join the faculty somewhere. And again, at that time, this is the early 90s, getting a PharmD degree, other than a few schools, it was not the entry-level degree. It was a graduate professional degree. And the programs were small. They typically had, 5, 10, maybe 20 students in each class. And so there was a lot of personal attention given by the faculty and the people you were surrounded. Your classmates were the best and brightest in the profession. So it was a really inspiring time. I was very lucky that I got a full scholarship to the University of Texas in the early 1990s. And that program, along with a few others, like I think of the University of Kentucky and the University of California, San Francisco, as being real leaders, producing most of the faculty that would go on to create most of the PharmD programs around the country. And so that really laid the foundation for the clinical pharmacy movement. And here I was at a school that was really at the center of all of that, and being surrounded by all these other people, including the faculty. So it was really inspiring,
Was Charlie Walton there at the time?
Charlie had just retired when I was joining school. So we overlapped for about 6 months. And Charlie, of course, was the person who founded that program and recruited all these phenomenal faculty. And he was from Kentucky. So just to show the influences of these folks and the, the nature of these schools. But they really seeded all of the programs that, for the most part, that occurred. Not to say they weren't excellent graduates from many other programs, but those 3 programs were highly influential during that time frame, for sure. And then, so I by happenstance, I go to a great school that's got some great faculty, a lot of inspirational folks there, get phenomenal training, do another residency while I'm there in ambulatory care, which was not, most people didn't do a second residency at that time, doing these specialty residencies. And ambulatory care was not the darling of pharmacy practice at the time. So it was mainly critical care and drug information. Remember drug information? Yeah. So, but then from there, I went to the University of Maryland. And again, it's sort of like, somewhat luck. It was a phenomenal institution. It still is. And at the time, the reason why I got hired is they had just made the decision to go to the entry-level PharmD as their sole degree. And they were one of the very first schools on the East Coast to make this decision. There had been other schools, mainly on the West Coast, to do this, and they were really a leader that kind of pushed the entire profession to move forward. If Maryland was going to adopt the PharmD degree, then maybe the profession should be doing that. And so, again, it was a phenomenal time. We were kind of a leading institution in making this transition, offering a non-traditional PharmD residency training program at night, which I got involved with. And obviously, I was an ambulatory care practitioner, and that became a very important part of the new PharmD curriculums, is increasing this part of the curriculum. Community residency training, which we also developed at Maryland. So there was a number of things that just all came together in my first 10 to 12 years at Maryland, which then led to opportunities to work in professional associations, because we were doing some pretty interesting cutting edge stuff at the time, and that really led to my getting involved in professional organizations and leadership and that sort of thing.
That's great. Yeah, that really ties in well with the history of our development of our profession. I really enjoy your perspective or your insight. I did not know all those details, and that's really very meaningful. One of the questions I asked is about, trying to look at what you think your legacy would be in 20 years. And of course, people say legacy, it's written after the fact versus, but maybe to rephrase that question is to, what do you think you would be most proud of in terms of your contributions to help advance our profession? Because that's part of legacy, and versus whatever the legacy is. Hopefully, you don't become a criminal, and we don't, other things that we forget about. But what would you be most proud of in terms of your accomplishments that really will contribute to your legacy in the profession of pharmacy?
Yeah, so I would probably distill it down to one thing. I hope that I'm remembered for preparing pharmacists for direct patient care roles, particularly in ambulatory care settings. And so that comes, and the themes of that, I think, comes in several ways. First, obviously, the education and training of pharmacists for these direct patient care roles, particularly in ambulatory care settings. And that, back in the early 1980s, this is before I went back to get my PharmD degree, I was fortunate enough, as I mentioned, to work for this small chain of pharmacies in southern New Hampshire called Freedom Drug. And it was an independent chain, and the owner could make all sorts of independent decisions. And one thing he believed in, because of my training as a resident, he felt that, there should be residencies in community pharmacies. And so I agreed to lead that effort. And we were among the very first community pharmacy residencies in the country. So it was founded in 1988. We knew of one other program at the time. This is before there were standards for this, any of this. So we were just kind of making it up as we go along, based on models based in hospitals.
Exactly.
And so, that led to my interest in going to academia. I went back to academia because of my experience developing this community pharmacy residency at Freedom Drug. I was asked to do it again at the University of Maryland, and that program still is in existence today. The Freedom Drug one is not, but the University of Maryland program is still around today. And then I've been very involved in ambulatory care residency training programs through those years too. So I think residency training in ambulatory settings, community and ambulatory care, and helping to build that through my personal involvement as a residency director and a preceptor. And even today, I'm still very involved in ambulatory care residency training program here at the Mississippi would be one theme. I think the other theme that's really been important to me is having pharmacy, ambulatory care pharmacy recognized as a specialty and having board certification in ambulatory care. So I was appointed to the committee to put forward the petition to recognize ambulatory care as a specialty to BPS. So I think this was really an important point for the discipline of ambulatory care pharmacy practice, because it recognized it as a special area within our profession, equivalent to critical care, pediatrics, or any other number of specialties. But it also put us, I think, on equal footing with other members of the health professional team, particularly family physicians and internists who are also board certified in their disciplines. And so it gives us credibility.
Mhm.
So, and I think it also sends a signal that community and ambulatory care pharmacists, at least those who get board certified, want to live by high standards, who, want to have maintain their knowledge and skills in an ongoing way by maintaining board certification, and that we are fully capable of making drug therapy decisions, and being a full partner with patients and other health professionals in the care of patients. So I think board certification is one that I'm also very passionate about, and hope I've left a legacy by helping at least
Absolutely.
get ambulatory care
Absolutely.
recognized. And then I think the third part of this would be, my published works.
Mhm.
So I've been an author of several books. I'm currently one of the section editors in pharmacotherapy, a pathophysiological approach, which is one of the textbooks. Most students call it DePiro,
Mhm.
but it's a textbook that I've been involved with. And I also manage and editor of a online community of practice called iFormRx for the past 10 years.
Mm.
And so this is a forum where pharmacists, ambulatory care specialists get to discuss the latest research. We publish
Mm.
peer-reviewed commentaries about cutting-edge research articles that should influence practice, and we discuss how that evidence should be implemented into practice and what kind of patients would benefit from it. So I think, my published works hopefully have help pharmacists translate evidence into practice, make them better consumers
Mhm.
of the evidence that's available, to be more critical of that evidence, skeptical at times of that evidence,
Mhm.
understanding its strengths and limitations, and knowing how to apply findings from research to the care of patients that are sitting right in front of them right at that moment.
That's a I think that's a really good description of the legacy you will be leaving, or you're leaving for sure. Thank you very much for that. One of the questions I have is, what advice would you give to students in their journey, in their professional journey, especially as they become leaders to help advance the profession?
Yeah. I call them well, there's three things: competence,
Uh-huh.
commitment,
Uh-huh.
kindness.
Yeah.
Then it's not exactly the three C's, because kindness.
Kindness, yeah. Well,
Kindness.
I use the word caring. I have some similar C's. I think I have four C's, and I
Yeah.
use caring.
Yes.
Yeah, very good.
And so, I mean,
Mm-hmm.
so if you're competent at what you do, if you keep commitments by delivering high quality work on time, or better yet, ahead of time,
Mm-hmm.
and if you're a pleasant person to interact with, then you will always have a job,
Mm-hmm.
and people will always want to be around you, because you're
Right.
competent, you're committed, and you're caring,
Exactly.
or kind.
Exactly.
And so, being competent means, have an excellent education, lots of training, and experience. And experience is a part of what keeps our competence. So doing challenging tasks, taking on new tasks, looking for new ways to expand your experiences,
Mm-hmm.
and force you to learn new skills. And sometimes that means going back to school, getting formal education. Maybe it's more informal education, but you're always in this lifelong learning mode to be better at something.
Exactly.
Always. I mean, every day I try to learn something new.
That's great.
And then, being dedicated to doing a great job and delivering it on time. I can't tell you how important that is. And it doesn't matter if it's paid work, where you need to deliver be timely in your work, but also volunteer work. I get frustrated, and I'm sure you felt this too, is someone volunteers for a task because it looks good, but then they don't deliver, right? They don't
Right.
deliver a good
Right.
quality product or on
Right.
time. They're the
Right.
one that's kind of holding up the whole group. And that is really negative. I would say, whatever you can do when you're committed, you do things on time. And that means having good time management skills,
Mm-hmm.
project management skills and things like that. But it's also attitudinal, like you want to do a good job. And so commitment is really important. And then kindness, being kind to other people, always trying to be a pleasant person to be around, someone who cares about other people and their well-being, someone who has a good sense of humor. I can't say that's one of my strengths, but if you have that, that's great. And don't taking yourself too seriously, and then also being forgiving of people who don't live up to your high standards. So while it's frustrating for me that people don't deliver their work on time, for example, I need to be forgiving. I mean, we can't be hard on people that they can't always live up to our expectations. They've got their own worries and concerns and issues that they have to deal with. And so focusing on that first, I think is really critical.
Those are
So
great. Those are great words of advice. I think that's super. This is going to be really good. I'm so excited about what I'm hearing from people. You can read about all this stuff in textbooks, but hearing people real live say it, it makes it real personal, and I really appreciate that. The last question I want to conclude with, and I asked this question because it's about history. We're making history today, obviously, COVID-19 pandemic. I mean, so many years from now, they'll be talking about this, and how we respond and what it means for us will be interesting. It'll be part of history. It is history. So maybe describe for us briefly, how you see this as an opportunity for the profession to advance itself. And there's set things, obviously. And I ask this question because, we gained some insight, but it'll be interesting to hear this in a few years. And we look at, we'll be reading about our history in the 2020, and they'll be the next decade, and they'll describe COVID-19 pandemic. And I suspect, hopefully, it will be a turning point for our profession as well. It was hopefully an opportunity for us as we seized the moment. So maybe take off from there?
Yeah, sure. So, well, I think there's several opportunities. Obviously, you're asking the question because you see some opportunities here. And so one of the opportunities early on, one that we're facing right now in the first month or two of this pandemic, is really in the acute care setting, this kind of first wave of the transmission of the virus, where we're really relying on our hospital workers, and this obviously includes hospital-based pharmacists to take care of the sickest patients, right? And so pharmacists who work in these settings are working in ICUs, they're delivering the medications, and they're trying to sort out right now what kind of treatments actually work, because right now we don't have a lot of good evidence, and I think this is where pharmacists obviously can help decision makers make some better decisions about what kind of treatments are likely to work and not work, and being helpful in the process of collecting data about whether these treatments that we propose actually are useful or not. Also, what's happening right now is drug shortages, because the supply chains have been disrupted. And so pharmacists, it becomes, you become acutely aware of the importance of people in doing the kinds of work that we do when it's not available to you, when there's access problems. So that's the short term. I think people will recognize the value that pharmacists bring to the table in this acute care setting. I think in the long run, though, we're going to face a second and third wave of the transmission of this virus. I mean, that's just unavoidable. That was shown in the pandemic and the Spanish flu in the early 19th century, is that it comes in waves. And as people resume their usual activity, we're going to get another wave of infections and people. And to mitigate those waves, I think hopefully we'll have a few things in place. First of all, we'll be able to advise people how to protect themselves better than we did during the first wave. I mean, we didn't know it was going to be coming. And I think so patient education and being a source of well-informed, evidence-based information for patients is really going to be, so we become a trusted, community-based health professional, as we always have been, but it highlights us. I think testing and immunization will be the next parts of the equations too. So we're going to need to test millions of patients, billions actually, if you think of this on a worldwide scope.
Right.
And we're going to need to immunize. Once we have an effective immunization, we're going to need to immunize millions and billions of patients.
Mm-hmm. Mm-hmm.
And there's really no place that's better suited for that than community pharmacies.
Mm-hmm.
So we have the capacity, the bandwidth, and the places, the accessible places where people live and shop already that can make this accessible to people. Many people, by the way, do not have formal relationships with the healthcare system right now. And that's true worldwide, but it's true in the United States. A lot of people don't have primary care physicians. And yet, we got to immunize everybody, not just people with primary care physicians, right? So, and the only place to do that is community pharmacies, because that's a place everyone goes into. It doesn't matter if you have a formal relationship with a health professional or not. So I think the accessibilities of pharmacy will be our key strength in helping to address a pandemic like this, at least in the long run.
Yeah. Thank you very much. I appreciate those comments. It's very insightful. Okay. Thank you very much. I'm going to stop, not end the meeting, but stop the recording. Thank you.
Okay.
It's been a pleasure.